Well, hello, everybody. So before I begin, let me just say one of my bucket list things was to speak to a standing room only audience. And thank you very much. Now, I won't tell everybody it was a really small room, but in my story, it will be much, much bigger. So again, my name is Maynard Friesz, and I work for Cure SMA. Cure SMA is the leading national organization that represents children and adults with a rare disease known as spinal muscular atrophy, or SMA. SMA is a neuromuscular disease, and it impacts the muscles used for everyday living activities such as coughing, breathing, walking, and other movements. SMA impacts individuals and children and adults in all 50 states. This is a list of who we are in your communities and in your states. So SMA is a neuromuscular disease and affects physical abilities, but it does not affect cognitive or other abilities. And so our folks are top of class in high school and in college. They are active in all parts of the economy, active in their community, volunteering and participating. They are moms and dads, their fathers, their sons and daughters, their aunts and uncles, their grandparents, and they're your neighbors. All those great things are only possible because of caregivers. As this adult with SMA said, without caregivers and caregiving hours, I would not be able to live independently, be successfully employed, or enjoy anything fun as I would be stuck in bed. All because without caregivers, none of that is possible. SMA is a medically complex disease. It worsens over time. And so people's needs don't change. They maintain or even increase over time. And they require the needs of a caregiver to be able to do daily functions such as dressing and grooming and bathroom support, as well as complex activities such as respiratory support and nutrition assistance. To help illustrate this, I have a quote here from a 26-year-old with SMA. He's a college graduate and is in software engineering. Because of his SMA, he doesn't have strong chest muscles. And as a result, he cannot clear his mucus from his lungs the way most people do. He says that if it's not cleared, it settles and can quickly turn into pneumonia, something that he was hospitalized for repeatedly as a child before he had consistent, well-trained caregivers. He goes on to say, clearing my airways requires a precise manual cough assist technique. A caregiver applies pressure to my chest in exactly the right place, with exactly the right amount of force. Too little and it does nothing. Too much or in the wrong spot and it can injure me. I actually spoke with him by Zoom just a couple weeks ago, and his caregiver demonstrated this technique, and I will say it is very complex, and it would be something that I would not want to do without lots and lots of training. So people with SMA and others are able to access caregiving through Medicaid. Medicaid, as you know, is the primary payer of long-term services and supports. And because of bipartisan legislation back in the 80s, signed into law by President Reagan, Medicaid is allowed to provide institutional level care in the home and in the community. Now, this is where folks want to receive their care anyways, but it's also been effective in terms of health outcomes, and it's also certainly cost effective as well. Because of access to Medicaid caregiving, our folks are thriving. People with disabilities, people with rare diseases, people with SMA. They're thriving in the school place, they're thriving in employment, and they're thriving in the community. I won't read these, but you can see some of the quotes from adults with SMAs all across the country and how Medicaid caregiving provides them the opportunity to maintain their health, live independently, and participate in their community. Despite the fact that Medicaid caregiving is essential, it's vital to the day-to-day life of people with SMA and other rare diseases, and that the proof is that it increases health outcomes and is cost-effective, our folks continuously struggle to access Medicaid caregiving. As this slide highlights, we surveyed the SMA community. Our folks struggle to find caregivers to fill the caregiving hours that they have. And when they have a caregiver, they struggle to retain those caregivers, particularly those that are reliable and those that are trained. Most difficult, as it says here, is the nights and weekends. Just because they don't have a caregiver at night and weekend doesn't mean that that need doesn't go away. In addition, oftentimes our folks don't receive the caregiving hours that they really need to truly be independent through the caregiving hours from their state. More recently, we have been under threat and pressures based on budgetary issues at the state level and at the federal level, particularly related to the implementation of H.R. 1. And then more recently, we believe there's a lot of misunderstanding or lack of understanding about what the vital nature of caregiving really is. As I mentioned, for people with SMA and other rare diseases, caregiving is essential to health and independence. It's not optional. It's not wasteful. It's also skilled and complex, as I shared with that example of the cough assist. It's not simply companionship or conversation. And then we believe that caregiving is not a one-size-fits-all solution. It has to be tailored to the individualized needs. If you have two people with SMA, their needs are very different based on their personal lifestyle and based on their severity of the disease. And we believe policy needs to recognize one-size-fits-all is not the way to go for caregiving. I want to demonstrate why caregiving, Medicaid caregiving, is really a lifeline for people with SMA, and it's not and shouldn't be considered a budget line. It's this case study of a 38-year-old adult with SMA. As you can see, he lives independently, participates in his community, even serving on a national board, and he works full-time. He accesses 42 hours of caregiving a week. Now, that may seem like a lot. That's a work week, right? We all work around 40 hours a week. But when you think about it, it's only 6 hours a day. He gets 3 hours of caregiving in the morning, which allows him to get out of bed and into his power wheelchair, go to the bathroom, eat, shower, get dressed, and then positioned into his workstation. Then he's alone from 9 o'clock until 6 o'clock, meaning that during the workday, he literally minimizes what he eats and minimizes what he drinks because he doesn't have the support during the day. Then he has a caregiver who comes in the evening, and that caregiver then gets him back into his power wheelchair, get him fed, get him to the bathroom, do some errands, and then prepare him for nighttime. And as you see, between 9 and 6, he's alone again. I just want to highlight where the risks are in his current schedule at 42 hours a week. He's alone between 9 and 6 in the afternoon. He's alone between 9 p.m. and 6 a.m. Now, he doesn't have the physical ability to be able to reposition himself. That can cause pressure sores. He doesn't have the ability to get something to drink in the middle of the night or go to the bathroom. That can cause dehydration and cause urinary tract infection. This is what his current schedule is. And if there is policies that happen at the federal or the state level that somehow impacts his ability to get those 42 hours, even by a half hour, what are you going to cut from his schedule? Do you skip the bathroom break in the evening? No food in the morning? I mean, that's really what's at stake for people with SMA. And that's why really our mantra is we can't have Medicaid be a pay-for reconciliation or for any other future legislation. The stakes are just too high for people with SMA. Now, we understand that the intention is not to cut caregiving for people with disabilities and people with rare diseases like SMA. That said, we also understand that the ripple effect at the state level can oftentimes lead to cuts in eligibility or cuts in care to the very people that we want the program to be for. In addition, we ask that you continue to maintain, protect, and strengthen existing Medicaid home care options, particularly related to self-directed care. This is where an individual with SMA and others can pinpoint exactly when throughout their day they can get that caregiving services so that there isn't big gaps throughout the day. And in addition, while this isn't something that all of our folks use, it's really more rare, paid family caregiving. It's a vital option for those who require it, particularly for rural areas where the pool of caregivers just isn't there. And so having a paid family caregiver is the only option sometimes. Also, SMA gave the example of a weak chest muscles. A simple cold can lead to several days of hospitalization for a person with SMA. So having caregivers rotate in and out of a house is really not safe for those individuals. Paid family caregiving allows more health for that person and minimizes hospitalization, which is a cost saver for the entire system. This is actually my last slide. I wanted to close here with a quote from an adult with SMA. They said, "Every day, every action, every dream, every simple task is blurred by SMA." I highlight that just to highlight the fact that SMA is really a devastating condition. It's a medically complex condition, and our folks have challenges that they have throughout their daytime. That said, because of medical equipment such as power wheelchairs, and because of access to caregivers, they're able to do great things, all the great things I highlighted in an earlier slide. My ask of you, all of you who are working in policy, is consider the impact that your changes could make on a person with SMA. Our hope is that public policy isn't just one more thing that blurs or impedes or restricts their ability to take action, to dream, and to take simple tasks. Thank you very much, and I'll turn it over back to Jamie.
Well, thanks so much, Maynard.